showing the scalp and layers of the meninges. Now, meninges, the brain is enclosed by three meninges, membrane or in Greek as follows: outer dura mater, middle your arachnoid mater, inner is pia mater. Left of meninges, arachnoid mater, pia mater, lepto thin Greek. Spinal meninges are described in chapter 4. That's a dura mater. Dura mater, the cerebral or cranial dura mater is the thickest, toughest, and the outermost fibrous covering of the brain. Layers of dura mater, the dura mater, two layers, outer endosteal, endocranium, and inner meningeal layer. Now with the bone, that is endosteal, and the meningeal layers. Now you can see the endosteal layer here, endosteal layer is here, and the meningeal layer is green here. Arachnoid matter, green. The meningeal layer in between, and this is the superior sagittal sinus, falx cerebri. This is the red in red, is pia mater, and this is the subarachnoid space, superior sagittal sinus. Now, subdural space, arachnoid matter and subarachnoid space and pia mater. Now, this is very, it's important when you are getting a CT scan brain or your CT scan brain or any MRI of the brain. If there is a trauma or tumor or your blood collection, hemorrhage collection, so you can interpret that what is the prognosis of this injury or the tumor. Accordingly, you have to send to a higher center that is doing neurosurgery, or it has some medical treatment if that is to be given. Now this is important in the perspective of critical importance, and folds of dura mater. The dura mater shows the following folds: falx cerebri, tentorium cerebelli, falx cerebri, tentorium cerebelli, falx cerebelli, diaphragmatic sella. Now this is the, if you take a section of the skull, you can see the base of the skull and the sphenoid bone where the pituitary is located. The diaphragmatic sella, it gives a hammock-like attachment to the sphenoid bone. Now, for details of cerebral dura mater, intracranial dural venous sinuses. The dural venous sinuses are the spaces or channels present in the dura mater. These are lined by endothelium. Arachnoid mater is the thin transparent layer that lies between outer dura and inner pia mater. It surrounds the brain loosely without dipping into sulci of brain except longitudinal fissure and stem of the lateral sulcus. Subdural space lies between the meningeal layer of the dura and arachnoid mater. Cerebral veins traverse through subdural space. Subarachnoid space lies between the arachnoid and pia mater. It contains CSF and blood vessels. Subarachnoid space lies between the arachnoid and the pia mater. It contains CSF and blood vessels. Now, these are your dural folds and dural venous sinuses enclosed within them, viewed from supralateral aspect. Now, this is the transverse sinus, straight sinus, tentorium cerebelli, free margin of the tentor cerebri, and your falx cerebri, this much. Now, diaphragm cella is the falx cerebri, inferior sagittal sinus, and superior sagittal sinus. Please go home and see the dural venous sinuses and also your dural folds. Now, you see, now folds of dura mater and dural venous sinuses. Coronal section through the posterior cranial fossa, the anterior part, B section through the middle part, and C section through the posterior part, posterior views of all sections, inset showing levels of section in green lines indicates endosteal layer and purple line indicates meningeal layer of dura mater. Now these are the sections here. You see the superior sagittal sinus. All books have this. Now falx cerebri, inferior sagittal sinus. This is transverse sinus. This is the tentorium cerebelli and tentorial notch. Now occipital sinus, your superior sagittal sinus, the falx cerebri and your tentorium cerebelli, straight sinus, superior sagittal sinus, transverse sinus, falx cerebri and occasional sinus, occipital sinus, tentorium cerebelli. Now, if you go and mugging, it becomes a bit difficult. So, first you draw the diagrams and slowly label them and read. So, half the work is done. Even if you cannot, in a hurry, you cannot complete. So, you just label, draw the diagram, you will get some marks. If it is 4 marks, you will get 3 marks. Now, the prolongation of arachnoid villi. These are the arachnoid granulations and subarachnoid space. These are the dural venous sinuses, arachnoid granulations and absorption of CSF. Now, these are small finger-like projections of arachnoid tissue projecting into cranial venous sinuses. Functions, they absorb the CSF and transfer it to the bloodstream. Arachnoid granulation, with advancing age, the arachnoid villi enlarge in size to form pedunculated tufts called arachnoid granulations. This is the arachnoid granulations. They also absorb CSF. They may produce depression in inner surface of cranial bones. He is forming a depression here. Now, clinical integration, meningiomas are tumors arising from the arachnoid villi. Now, if that, see, these are visible in CT MRI, but if you see, you have to know the normal. These are normal. Now, it is penetrating. Meningiomas are tumors arising from arachnoid villi. Cranial pia mater, it is thin vascular membrane that closely invests the brain. Pia mater, loving mother in Latin. It is a thin vascular membrane that closely invests the brain. Pia mater is loving mother in Latin. It follows sulci and gyri of the brain. When you go to the lab, anatomy lab, you will see the specimen and you can see with gentle, best is you take earbuds and you slowly, in sulci and gyri, you see the layer. You see the layer, you have to handle gently and now it contains numerous blood vessels and capillaries. It nourishes the brain and spinal cord. See, any operations of the brain, these small cotton swabs are used in the, like the your salsa angina. Now, hello. Now, what I want to stress is that Dr. Joseph, he was one of the pioneers in neurosurgery in CMC Vellore. He used to come over to Bardwan, my friend's nursing homes, Camry, and he used to, our sister would accompany him in his team from Coimbatore, and she was in charge of counting all the swabs or what the material they are handling in the brain. Say if there's a count was by mistaken and the brain was closed, then that can lead to many problems. Why I am telling you, you start handling things, your patient, even when you are in the holding the pulse, you have to be very meticulous, and you're gentle, caring and handling anything in medicine and surgery. Now, you have to develop that art. So, prolongation of pia mater, perivascular sheaths. The pia mater provides sheaths around the vessel entering or leaving the brain substance. Now, perivascular space, which shows Robin space, the blood vessels in the substance of brain are surrounded by sheaths of external pia mater and internal arachnoid matter. The space between these two layers are called perivascular space. The vessel peri means around, and in between, see, I'm just exaggerating, this space. That's always a space. You just, you take your finger, you take a thread and you just put it around. Then you see this is a vessel and the covering, your pia mater and the space in between. That space in between is the perivascular space. Now, which shows Robin space. Virchow had, he first came to show us that it has a space. He named it. Now, telachoroidea of ventricles, telachoroidea of ventricles. These are folds of pia mater surrounded by ependymal lining. These are folds of pia mater surrounded by ependymal lining. Choroid plexus, the tuft of capillaries and telachoroidea is together forms choroid plexus. It produces CSF. Now, choroid plexus can be a short note, mark it, and from there, your tuft of capillaries and telachoroidea together forms choroid plexus. It produces CSF, sheaths around cranial nerves. The sheaths around the cranial nerves, spaces in relation to meninges. Now, spaces in relation to meninges. This is important. Extradural, epidural, subdural, subarachnoid. Epidural, extradural space, it is a potential space between the inner surface of the skull bone and endosteal layer of dura mater. Subdural space, it is a potential space between the dura and the arachnoid matter. It is traversed by cerebral veins. Subarachnoid space, The subarachnoid space lies between the arachnoid matter and the pia mater, contains cerebrospinal fluid, trabeculae connecting the arachnoid and the pia mater. It gives spider webs appearance to arachnoid matter. Now, subarachnoid cisterns. These are pools of CSF at the base of the brain as dilatation of the subarachnoid space. They are as follows: cerebellomedullary cistern, Cisterna Magna. It is located between the medulla oblongata, inferior surface of the cerebellum, and the occipital bone. It is the largest cistern. It receives CSF from fourth ventricle through the foramen of Meninges and foramen of Lasca. These words, foramen of Lasca, foramen of Meninges, you have to know because you can be asked in Viva. Also, it can be asked in short question. It can be asked in your MCQ. Don't take it lightly because these have meaning. Now, contents. Subarachnoid cisterns, vertebral artery, part of the posterior inferior cerebellar artery, 9th to 10th cranial nerves, choroid plexus. Cisterna pontis, it lies between the pons and the clevis. It contains basilar artery, 5th and 6th nerve, cranial nerves. Interpedunculair cistern, basal cistern, it lies between the inferior surface of two temporal lobes. It contains circle of Willis, optic chiasma, bifurcation of the basilar artery and third cranial nerves. Now you see the cisterns. It can be a long question. It can be a long question, or you search your last 10 years question papers and see if it is there, and also it is in the competency based questions in your textbooks. Now, see this interpeduncular cistern, basal cistern, it lies between the inferior surface of two temporal lobes. It contains circle of Willis, optic chiasma, bifurcation of the basilar artery and third cranial nerve. Interpeduncular cistern described. Now, cistern of great cerebral vein, Cisterna ambiens, it lies in the space between the splenium of the callosum and the superior surface of the cerebellum. Cistern of the lateral sulcus, it lies in the front of the temporal lobe. It is formed by bridging of arachnoid matter over the lateral sulcus. The location of principal subarachnoids, mid-sagittal section, right medial view. See, this is a very important picture. Now, this is the fornix, this is the third ventricle, this is the corpus callosum, cistern of the great cerebral vein, Cisterna ambiens, fourth ventricle, this is the cerebellum, cerebromedullary cistern, Cisterna Magna, pontine cistern here, pons is here, interpeduncular cistern. This is important. The sagittal section in this level, location of principal subarachnoid cisterns, mid-sagittal section, right medial view. Now that is flow chart. Now clinical integration. Cisternal puncture. It is a process of insertion of needle into the Cisterna Magna to obtain the CSF or the drain the excess CSF. It is called suboccipital puncture. It is performed if lumbar puncture fails, alternate to lumbar puncture. Now, if in the Viva table, who is appearing for gold medal or honors, if you utter this cisterns and all, then they will ask you that your clinical integration, if the cisternal and if the lumbar puncture fails, then you have to do a cisternal puncture. Now, it is the process of insertion of needles into the Cisterna Magna to obtain the CSF or to drain the excess CSF. It is called suboccipital puncture. It is performed if lumbar puncture fails. Procedure, a needle is introduced into the Cisterna Magna to the midline above the spine of the axis. Direction of the needle in midline, forward and upward, parallel to the imaginary line extending from the external acoustic meatus to Nasion. Usually, when these procedures are done, you have to shave the head, scalp, and neck for any procedures or any operation in the brain. You don't have hair like this. So, now, cerebrospinal fluid. Write a short note on CSF. Write a short note on CSF circulation. The outcome of this lecture, these questions can come in any form. So please note it. Okay. Now, cerebrospinal fluid is modified tissue fluid that lies in the ventricles of the brain, central canal of spinal cord and subarachnoid space. Total volume 150 ml, 30 ml in the ventricles of the brain. Composition, it is clear, colorless, slightly alkaline fluid. Specific gravity 1005, 1008. Proteins 25 milligrams per deciliter and glucose 50 milligrams, chloride 120, lymphocytes 0 to 5 millimeter, cubic millimeter. Now, formation. Now, any alteration in this, your color or your specific gravity, proteins, glucose, chloride, lymphocytes, then you have to find the clue what has happened actually, what is suffering from or what disease or, okay. Now, formation, choroid plexus of the lateral ventricle produce about 80 to 90% of the CSF. Choroid plexus of the lateral ventricles produce about 80 to 90% of the CSF, remaining 10 to 20% by choroid plexus of the third and fourth ventricle. So, lateral ventricle, third ventricle, fourth ventricle. All these ventricles are producing this cerebrospinal fluid. Okay. Now, CSF circulation and absorption, functions of CSF protection, cushioning effect of CSF protects brain from trauma, nutrition, CSF nourishes the nervous tissue, protection from tissue pressure. In CSF, brain weighs only 50 grams, weight in air is 1,500 grams. Thus, CSF helps the brain to float and protects the basal structures in the cranial cavity from its own pressure. Waste product removal. CSF removes waste metabolism of the central nervous system. And it has a big role. Now, circulation of CSF lateral ventricle to through the interventricular foramen of Monro to the third ventricle, cerebral aqueduct of Sylvius to the fourth ventricle, your central canal of spinal cord, and a portion goes to the cerebrum through the foramen of Magendie, two foramina of Lasker, subarachnoid space, flows upward around cerebellum and cerebrum through the tentorial notch. Subarachnoid granulation, absorption, venous blood of superior sagittal sinus. This, you please note it. And the flow sheet, it can be, you just draw this chart, you will get the marks. But you go on writing 1, 2, 3, ventricle, lateral, just you draw the chart and try to draw a diagram. Yeah, this diagram. See, this is the foramen of Monroe. This is the foramen of Lasca, the interpedicular cistern. This is the cerebral aqueduct of Sylvius. This is the foramen of Monroe, and this, see the arrows. Dekho, practice figure circulation of cerebrospinal fluid. This is the, you must know. It can be a long question also. Not this. CSF and the circulation of cerebrospinal fluid. Clinical integration. Now, myotactic or stretch reflex along elongation of spindle on stretching the skeletal muscle produces reflex rapid contraction of the muscle. This is called the stretch reflex. Component muscle stretch, stimulation of type 1 and type 2 sensory nerve fibers of muscle spindle, synapses with alpha, motor neurons and skeletal muscle contraction. This neurotendinous spindle, neuromuscular spindle, motor end plates, afferent neurons, alpha motor neurons. Now, stretch reflex. This clinical myotactic or stretch reflex can be a question about 10 marks. Now, this is a congenital hydrocephalus. It is caused by excessive cerebrospinal fluid accumulation in the brain ventricles and subarachnoid space. This causes increased intracranial pressure and increases size of the ventricle. Infants with hydrocephalus shows an unusually large head and a bulging frontally. This is the, actually nowadays, due to the use of ultrasonography, especially in pregnancy, anomaly scan. Now, in anomaly scan, you can detect this hydrocephalus. That is in between the 18 to 22 weeks of pregnancy, you do an anomaly scan. Then you counsel, with proper counseling, you have to speak to the mother and the father also, and tell them what can happen if you carry on the pregnancy. Naturally, you have to guide them and go for an abortion. Because by 30 weeks, sometimes they come on the last lap of pregnancy, they come with a ultrasound, with a big head and all this. But nowadays, there is awareness among people, but mostly what's happening, the government is giving 2 USGs free, the first and the second. Now, I have seen many reports that many of the gynecologists, they overlook, or many MBBS student who has done a diploma or some extra course in gynecology, they even overlook. You don't overlook. That can be delivered normally, and if it is not possible, then you do a hysterectomy according to the age and size of the fetus. So, if you are an MBBS doing a duty in the outdoor, in your clinics, please assure that she has to do a first scan It can be within 8 to 10 weeks. Then second scan, NT scan, then your anomaly scan. Anomaly scan gives you lots of information, lots. Your bony growth, if there is a shortening of limbs or not, then is your cleft lip, any cardiological problem or not. Then you can do fetal echocardiography. So if the child is born with a birth defect, it is really saddening in this era. Now, you can see the hydrocephalus definition. Hydrocephalus is an abnormal increase in the volume or accumulation of cerebrospinal fluid in the cerebral ventricle or subarachnoid space. Anatomical basis of hydrocephalus: excessive production of CSF, obstruction in the circulatory pathway of CSF, failure of absorption of the CSF. The obstruction may occur at the following sites: inside the ventricular system, obstruction at communicating channels, obstruction at the interventricular foramina leads to distension of lateral ventricles, obstruction of aqueduct of Sylvius leads to distension of both lateral ventricles and third ventricle. Obstruction at the opening of roof of the fourth ventricle leads to distension of all the ventricles. At the opening in the tentorium cerebelli, if the subarachnoid space surrounding the midbrain passes through the tentorial notch is blocked due to adhesions, the CSF from below the tentorium cannot form upward through the tentorial notch and spreads over the surfaces of the cerebral hemisphere to reach the arachnoid granulation absorption. Now see, obstruction to CSF outflow, accumulation of CSF, dilatation of ventricles, large head and bulging frontal congenital hydrocephalus. Anyway, you have to go for your exams already third semester. Please take care of yourself. Care in everything, in every aspect. Psychological, your nutritional, and also hydration. And you have to slog it. It's 2 months left, 60 days left.